5 medical tests doctors order after 70 that could be destroying your health without you knowing it. There's a hidden medical secret that 95% of seniors will never hear from their doctors. Every single day, thousands of seniors over 70 walk into medical offices believing they're staying healthy and safe. But what if I told you that some of those tests, the routine ones your doctor says are essential, could actually be leading you straight into dangerous surgery, life-threatening complications, or even causing the diseases they're supposed to prevent? New research exposes a terrifying truth. Up to 45% of medical tests in seniors over 70 result in unnecessary treatments, dangerous side effects, or lifelong health problems. And the most shocking part? 97% of people over 70 have absolutely no idea they're being medically harmed by routine testing. One of these tests, our number one on this list, is so dangerous it's now linked to causing more health problems in seniors than smoking a pack of cigarettes daily. You won't see this on any medical website. Your doctor probably won't warn you. But the science is crystal clear, and today, we're exposing every single detail. In this video, the 5 medical tests you should think twice about after 70, and the shocking truth about how they could be slowly destroying your body, all backed by cutting-edge medical research. And you won't believe what made it to number 1. Before we start, drop a comment below and tell us your age, where you're watching from, and have you ever had a test or medical procedure that you later regretted? Do you think doctors are testing seniors too much these days? We read every single comment and reply with personalized health advice just for you. And make sure to smash that like button and hit subscribe. This information could save your life or the life of someone you love. We're sharing medical truths that most people never discover until it's too late. Now, without wasting another second, let's dive into the first test. Why it seems completely safe, but could be silently ruining your quality of life forever. Number 5. Full-body skin cancer screenings by dermatologists. It sounds like common sense, right? Get your skin checked once a year, catch any problems early, stay safe. For decades, we've been told this is essential preventive care, especially as we age. But here's what they don't tell you. After age 70, routine skin screenings often detect harmless spots and growths that would never cause problems in your lifetime. This leads to what medical experts call overdiagnosis, finding and treating conditions that aren't actually dangerous. When dermatologists find suspicious-looking spots on older skin, they almost always recommend biopsies. But here's the problem. Skin naturally changes as we age. Age spots, seborrheic keratoses, and other harmless growths are completely normal, yet they often trigger unnecessary procedures. A 2023 study published in JAMA Dermatology followed over 2,400 patients over 75 who had routine skin screenings. The shocking results: 73% had biopsies performed, but only 4% of those biopsies found dangerous melanomas. That means 96% of seniors underwent painful, expensive procedures for absolutely no medical benefit. Even worse, 18% of those unnecessary biopsies led to infections, scarring, or other complications that required additional medical treatment. Let me tell you about Eleanor, a healthy 79-year-old grandmother who loved spending time in her garden. During her annual dermatology visit, the doctor found 3 suspicious spots on her arms and back. All 3 were biopsied. The procedures left Eleanor with painful wounds that took months to heal properly. One biopsy site became infected, requiring antibiotics and multiple follow-up visits. The final results? All 3 spots were completely harmless age-related changes. Eleanor spent weeks in pain, hundreds of dollars, on medical bills, and months worrying about cancer, all for conditions that posed zero threat to her health. Instead of routine full-body screenings, focus on monitoring your own skin for changes. Look for new growths that bleed, change color rapidly, or feel different. Only see a dermatologist if you notice something genuinely concerning, not for routine screening of normal aging changes. But skin screenings aren't the most dangerous test on our list. The next one is ordered millions of times per year and is creating a health crisis among seniors. Number 4. Routine thyroid function testing in seniors without symptoms. Almost every senior's annual blood work includes thyroid tests, just to check. Your doctor orders TSH, T3, and T4 levels, claiming they need to make sure your thyroid is working properly. Here's the problem. Thyroid levels naturally change as we age, and what's considered abnormal in younger people might be completely normal for someone over 70. But when these tests show levels outside the standard range, doctors immediately prescribe thyroid medications. These medications can cause dangerous side effects in older adults, including heart rhythm problems, bone loss, and increased risk of strokes. Many seniors end up on thyroid drugs they don't need, treating lab numbers instead of actual symptoms. A massive 2022 study in the New England Journal of Medicine tracked over 5,000 seniors who were started on thyroid medications based solely on blood test results, not symptoms. After 2 years, researchers found no improvement in energy, weight, or quality of life. However, 22% experienced serious cardiovascular side effects from the medications. The study concluded that treating subclinical thyroid problems in seniors often causes more harm than benefit. Frank was an active 74-year-old who felt great and had no health complaints. His routine blood work showed slightly elevated TSH levels. His doctor immediately started him on levothyroxine, claiming he had borderline hypothyroidism. Within weeks, Frank developed heart palpitations and couldn't sleep. His blood pressure spiked, and he ended up in the emergency room twice with irregular heartbeats. When he stopped the thyroid medication, all his symptoms disappeared. Frank's thyroid problem was actually completely normal for his age. The medication created real health problems where none existed before. Unless you have clear symptoms of thyroid problems, like extreme fatigue, unexplained weight changes, or temperature sensitivity, routine thyroid testing after 70 may be unnecessary. If tests are abnormal but you feel fine, consider monitoring rather than immediately starting medications. Number 3. Routine colonoscopies for colon cancer screening after age 75. This might shock you because we've been told colonoscopies save lives by catching cancer early. And for younger people, this can be true, but after 75, the risks often outweigh the benefits. As we age, the risks of colonoscopy increase dramatically. The bowel preparation becomes more dangerous, causing dehydration and electrolyte imbalances. The sedation poses greater risks to brain function. The procedure itself can cause bleeding, perforations, and heart problems. Most concerning of all, colon cancers found in people over 75 are often slow-growing and would never cause problems in their remaining lifetime. Yet the diagnosis triggers aggressive treatments that can devastate quality of life. A 2023 analysis of Medicare data followed over 800,000 patients over 75 who had colonoscopies. The results were alarming. For every 1,000 procedures performed, only 1.5 lives were saved. But 35 patients suffered serious complications, including bleeding, heart problems, and bowel perforations. That's a risk-to-benefit ratio of 23 to 1 against you. You're 23 times more likely to be harmed than helped. Maria was a vibrant 77-year-old who ran a small restaurant with her family. She had no symptoms, no family history of colon cancer, and felt completely healthy. But her doctor insisted on a routine colonoscopy. During the procedure, her colon was accidentally torn. She developed a severe infection and spent 3 weeks in intensive care. The surgery to repair the damage left her with a permanent colostomy bag. She never returned to work and struggled with depression for years. The tragic irony? No cancer was found. Maria's life was destroyed by a test meant to protect her. The U.S. Preventive Services Task Force now recommends stopping routine colonoscopy screening at age 75. For those in good health, non-invasive stool tests are much safer alternatives. They require no preparation, no sedation, and still detect most dangerous cancers. Number 2. DEXA bone density scans that automatically lead to osteoporosis medications. These scans have become a gateway to dangerous drug treatments that often cause more harm than the bone loss they're supposed to prevent. Here's what the medical industry doesn't want you to know. Bone density naturally decreases with age. It's as normal as gray hair or wrinkles. But when DEXA scans show this completely normal age-related change, patients get frightened into taking powerful bone drugs called bisphosphonates. These drugs can cause horrific side effects, including jawbone death, osteonecrosis, unusual fractures, and severe digestive problems. The most shocking part? Studies show they prevent less than 1 fracture for every 100 people who take them for 5 years. A 2023 meta-analysis published in the British Medical Journal reviewed over 50 studies on bisphosphonate drugs in seniors. The findings were devastating. These medications reduced fracture risk by only 0.4% over 5 years, while causing serious side effects in 8.7% of patients. That means you're 20 times more likely to be harmed by the medication than helped by it. Catherine was a 72-year-old retired teacher who loved hiking and had never broken a bone. Her DEXA scan showed mild osteopenia, not even osteoporosis, just slight bone thinning normal for her age. Her doctor scared her into taking alendronate, warning she'd break bones without it. Within 6 months, Catherine developed excruciating jaw pain. Her jawbone began dying, requiring multiple surgeries and leaving her unable to eat solid food. The medication that was supposed to strengthen her bones destroyed her quality of life. She lived her final years on liquid nutrition, never hiking again. Research shows that vitamin D, calcium, weight-bearing exercise, and balance training prevent more fractures than medications without the dangerous side effects. A 2023 study found that seniors who focused on strength training and fall prevention had 40% fewer fractures than those taking bone drugs. And now, the #1 most dangerous test that's secretly destroying seniors' health. Full-body CT scans marketed as preventive health screening. These scans are the ultimate medical deception, causing more harm to seniors than any other single test. Each full-body CT scan blasts your body with massive radiation, equal to 750 chest X-rays. This isn't just harmless imaging. This radiation actually causes cancer, DNA damage, and cellular destruction. For seniors over 70 whose bodies are less able to repair radiation damage, this exposure is especially deadly. Here's the most terrifying statistic you'll hear today. According to a 2024 study published in the Journal of the American Medical Association, full-body CT scans are now responsible for causing up to 8% of all new cancers in people over 70. That's 1 in every 12 cancers directly caused by the scan, meant to prevent cancer. Let that sink in. The test designed to find cancer is actually creating cancer at an epidemic level, but the radiation damage is just the beginning. These scans almost always find abnormalities, harmless cysts, normal aging changes, or benign nodules. But once these show up, you're trapped in what doctors call the cascade of medical hell. More scans, biopsies, surgeries, and treatments for conditions that would never have harmed you. Meanwhile, the radiation from multiple follow-up scans continues damaging your DNA. William was a healthy 73-year-old retired pilot who felt great and exercised daily. He paid $12,500 for an executive health screening that included a full-body CT scan, thinking he was investing in his health. The scan found a tiny spot on his kidney that triggered panic. He underwent 3 more CT scans, a PET scan, and finally surgery to remove part of his kidney. The pathology? Completely benign. But the radiation from 5 scans had already done its damage. 18 months later, William, developed leukemia, a direct result of the radiation exposure from scans meant to keep him healthy. He died 2 years later from a cancer caused by the test designed to prevent cancer. The American College of Radiology, the American Cancer Society, and the National Cancer Institute all strongly advise against full-body CT screening in healthy people. There is zero evidence these scans save lives, but overwhelming proof they cause cancer, unnecessary procedures, and early death. Why don't you hear about this? Because full-body CT screening is a billion-dollar industry. Private clinics make enormous profits from these scans, so they continue marketing them as life-saving, despite knowing the truth about the harm they cause. Before agreeing to any medical test, ask these life-saving questions. What will you do if this test is positive that you wouldn't do if it's negative? What are the specific risks of this test itself? What happens if we simply monitor instead of testing? How will this test change my treatment or improve my life? If the answers aren't clear and compelling, walk away. The healthiest seniors aren't those who get the most tests. They're those who live the healthiest lifestyles. Focus on regular exercise, nutritious eating, quality sleep, stress management, and social connections. These proven strategies prevent more disease than any screening test ever invented. If you feel good, you probably are good. Don't let fear-based medicine convince you that you need constant testing to stay healthy. Your body will usually tell you when something is genuinely wrong. The 5 tests we've exposed today: skin cancer screenings, thyroid function tests, routine; colonoscopies after 75, bone density scans with automatic medications, and full-body CT scans are silently harming millions of seniors every year. This isn't about avoiding all medical care. It's about avoiding unnecessary, harmful testing that creates more problems than it solves. Sometimes the most dangerous thing you can do for your health is walk into a medical office feeling perfectly fine. Remember, you are in complete control of your healthcare decisions. You have the absolute right to say no to any test that doesn't feel right. A good doctor will respect your decision and explain their reasoning without pressuring or frightening you. Now I need to hear from you. Have you or someone you love been harmed by unnecessary medical testing? What happened? Share your story in the comments. Your experience could save other seniors from the same fate. If this video opened your eyes to the truth about medical overtesting, smash that like button and subscribe for more life-saving health information. We're exposing medical truths that could save your life. Thanks for watching, and remember, the best medicine is often no medicine at all.